Good morning. Can you guys hear me all right? Oh, good. Well, it's a real privilege to be here. I come from Kelowna, British Columbia, so it's just a tiny bit colder there than it is here. Not that much, though, probably about pretty close to the same. But anyway, I am delighted to be with you. Thank you for coming out so early this morning. And many thanks to the people that came from so far away. I met two this morning, one from a couple from Australia and a couple from Germany, so that's pretty exciting. So my presentation this morning is, can we pause for a second? Was my time supposed to start at 1 hour and 30 minutes? Okay, so I'll say, I guess it's saying 1:13. I'm going, and I'm not going to get it done. My talk this morning is called Defeating Disease with a Whole Food Plant-Based Diet, What to Eat. And I've basically divided it into two parts. Part one, we'll be talking about diet and disease and really about the strength of the link and also why the plant-based advantage. And the second part is the what to eat part. And we'll talk about 10 steps to an optimal plant-based diet. So part one, diet and disease. This is what we know. We know that about 70% of the deaths in the developed world are due to chronic diseases of our own making. An estimated 90% of type 2 diabetes, 80 to 90% of heart disease, and 40 to 70% of cancers are considered entirely preventable. In 2011, the World Health Organization identified the 4 big lifestyle culprits, and they identified them as being a sedentary lifestyle, excessive alcohol, tobacco, and an unhealthy diet. And they identified the unhealthy diet as the #1 risk factor. And they defined an unhealthy diet as one that is based on processed foods with added fat, sugar, and salt, and animal products rich in saturated fats. It's low in vegetables, fruits, legumes, whole grains, nuts, and other high-fiber foods. And I want you to dissect this just a little bit. They really identify 2 categories of foods that are responsible for our epidemic of chronic disease. And those are #1, processed foods with added fat, sugar, and salt. And #2, animal products rich in saturated fats. Those they identify as the 2 big culprits. What do they say can help to prevent disease? Vegetables, fruits, legumes, whole grains, nuts, and seeds. Plant-based foods that are rich in fiber and phytochemicals and so on. At the highest risk are inactive populations consuming Western-style diets. The highest rates globally we find in North America, Northern Europe, Australia, and of course, the developing countries who are rapidly adopting our Western ways. And this is, I mean, we've probably all seen it, but it really is very sad to see because so many of these populations that lived off the land for so many generations very rapidly develop these diseases when they start eating the way that we're eating. At the lowest risk are populations who live simply, are physically active, and consume unprocessed plant-based diets. The lowest rates globally are some parts of rural Asia, parts of South America, and of course, the blue zones. And the blue zones, for those of you that are not familiar with the blue zones, these are places in the world where people live the longest, healthiest lives. They have more centenarians, people that live to be at least 100, than anywhere else in the world. But what's really interesting about these populations is not only do these people live a long time, but in the latter stages of their lives, they're still productive. Even at 90 or 100 years of age, they're still walking up the sides of the mountains and gardening. And that's what's really interesting about the blue zones. And there are 5 blue zones: Okinawa, Sardinia, Italy, Loma Linda, California, and that's the Seventh-day Adventists, the vegetarian Adventists, Icaria, Greece, and the Nicoya Peninsula of Costa Rica. And if you look at what common sort of thread can you weave through all of these long-lived, healthy populations, there are several. And the first is that they tend to have a very strong sense of family. They tend not to smoke. They're strongly socially engaged. They do constant moderate physical activity. So they're moving all day long. They're doing their gardening, they're walking, and so forth. And where diet is concerned, there are two big factors that are common to all blue zones. Number one, they all consume legumes or beans, lentils, peas, so forth, as part of their foundational foods. And two, they all consume plant-based diets, every single one. Not necessarily vegetarian or vegan, just the Adventists are vegetarian or vegan, but very strongly plant-based. And this man that you see standing here is an Okinawan centenarian. This man is 100 or more years of age. He was just identified as a centenarian. And just look at this man. He's got a shovel over his shoulders. Look at the definition of the muscles in the arm, in his arms, his veins. Is this not what we all want to look like when we're 100 years old? This is unbelievable. And look at his face. He's so cute.